And I have something unique to share with you because I have insights that most people don't even understand exist. So, for example, what happens if somebody walks in and says, look, I have a terrible flat foot and it really hurts. What can I do to realign it? When I walked in this morning, that's exactly what Barry told me. So this, I wanted to define for you how we look at feet. So this foot is called a normal foot. And the reason this is called a normal foot is because this foot is perpendicular to the weight-bearing surface that you're standing on. Why don't you sit down and make yourself comfortable? So this foot is normal because by definition, a foot that's perpendicular to the weight-bearing surface is what we define as normal. So this foot would be normal. So if any which way I turn the foot, this foot stays perpendicular to the surface. This is the position where people are not going to have any problems whatsoever. So they can come in, they can fit any shoes they want to wear, do whatever they want. This is the normal foot. However, most oftentimes, not all the time, I would say probably closer to the 70 to 80% of the time, a person walks into the foot like this. So, for example, this young man here has this kind of a foot, where the foot sags in the middle part of the arch part of the foot, and the foot turns in an inward direction, and this is called a flat foot. Now, a flat foot doesn't mean that only that the arch is flat, but the tendons and the muscles and the nerves that go behind the ankle joint through the tarsal canal, the whole structure of the foot is out of alignment, like a car. The front end of a car, it's out of alignment. It's sagging. It's going to create knee problems, low back problems, other issues for you, and pain in the ball of the foot, the pain in the big toe joint, the bunion deformity. As the foot rotates inwardly, you're creating the bunion deformity because the big toe is being pushed over. As the big toe pushes over, it creates a hammer toe. It leads to all kinds of syndromes. So my talk to you today is to really give you enlightenment that nobody else is going to ever give you. And that is to pull it all together. How do I create a foot that has no problems? Because then I can fit them with any shoe that they want. And the answer is, I need to restructure this foot, this left foot, and turn it back to where it was originally. Once I can do that, as I can realign the foot back to normal, you guys have no issues with anybody walking in and having any problems. And this does not, and I repeat, does not involve putting in an insert or an orthotic. So this is a unique approach that you probably have never heard of. And so this is, I think I'm going to go through some anatomy quickly for you, and then we'll show you what's done. So the ankle joint is the topmost joint that we most often deal with in terms of runners and people who walk. So this is composed of two bones, the tibia and the fibula, that articulate, that have the talus underneath it, and then the calcaneus. Now this has to line up in a straight line. So for an alignment to be correct, I need to have all three structures, the ankle joint, the talus, and the calcaneus, lined up literally like a pen, like a straight line. When that happens, you're in a normal, good position, and everything is fine. What happens is, as you rotate, the talus, this is this bone here, that sits on top of the calcaneus, moves out of place. So I'm going to show you that. I'm going to zero down on this problem, and I'm going to show you exactly what happens. So the most important structure, and for me as a foot doctor, is this talus bone. So if I look at the rest of the foot, the bunions, the hammer toes, the plantar fasciitis, the heel pain, all of those problems are subsumed, which means they come under one category, and that is that the talus moves out of place on the rest of the foot. That single bone moving out of place causes all the other problems that you're going to see. Isn't that an amazing thought? So you can correct most problems by correcting the talus on its position. So what I'm going to show you now is an interesting little tidbit for you. This is an example of the talus sitting on the calcaneus. I've isolated these two bones because the rest of the ankle and the rest of the forefoot come from the back of the foot, which is called the rear foot, and that causes all the problems. So now, what do you see underneath the talus and the calcaneus? If you look carefully, you can see that there's a little tunnel that goes underneath the talus bone. Now that tunnel is the key concept that I want to give you. And after this, you guys can become foot surgeons too. So here's how this works. If I took a pen, I could literally go from one side of the foot through that tunnel, out the other side, and I could pass a needle or anything I wanted through the whole foot, from one side, out the other. Patients freak out when you do this, because I do this often in terms of injections and things like that. They say, how could you do that? I said, well, I didn't do this. God created a tunnel underneath this bone called the sinus tarsi, and that's that little tunnel that you see right there. Now, when you walk, and the person who has this kind of a flat foot walks around like he does, what happens is every step, and listen to this words, every step this bone moves out of place. It dislocates, like a car that's out of alignment. So every step he takes, this bone moves out of place. And because he does that, all the tendons and muscles and things move out of place as well. So it's like, a falling structure. If this bone doesn't line up and stay in place, everything else moves out of place. And it's just logical. So the question to me as a surgeon becomes, how do I keep this bone in place, lined up with the ankle and the foot? And then you've got everything else solved. So I'm going to show you how I do it surgically. Outpatient, local anesthesia, come in, 3 hours later, they walk out, and they go home with no cast. That's a pretty awesome statement to make. And so the concept is pretty simple. If you take this bone, and this comes apart without any bleeding, there's a little tunnel underneath the talus bone that I showed you. 3/4 of that tunnel is on the underside of the talus bone, and 1/4 of it is inside the heel bone. Together, they make that tunnel. Now, a good friend of mine from Michigan came up with the concept, if I take this screw and make it out of titanium. Now, titanium is a special metal. When you go through the airport, it does not ring. Okay? If I take this screw and I make it in different sizes and I place it into that tunnel, I didn't change the tunnel. I didn't fuse any bones. I didn't do anything else. Just place it into that canal. Now, can this bone dislocate? The answer is no. In other words, I can alter the structure of an entire foot, running, jumping, whatever else you want to do, marathon runner, whatever you want, by placing the right size titanium device into that hole and keeping it there. The bone can't dislocate, which is the procedure that he needs.
Sign me up.
I'm telling you, this is the way to go. And then the rest of his life, the problem is solved.
No orthotics.
No orthotics.
You can run without pain, whatever.
Nothing else.
Activity he's
Shoes
doing.
fit. They don't gap, especially for the ladies. It's an unbelievable thing. Now, what happens is this for 5 years, 10 years? No, this is for the rest of their life because the titanium lasts 150 years. So I usually tell my patients, look, after 150 years, you come back, we'll discuss what's next. But that's it. They're solved. They're done. Instead of always going back, changing shoes, can't buy this, can't buy that, can't run, can't do this. Instead of saying limitations, there's no limitations. Now, does this apply to everybody across the board? No. I would say close to 70 to 80% of the problems that I see. It doesn't apply to people that have high arches and structures that are rigid. This is what's called a flexible flat foot. Now, just to show you how dramatic this could be, what I've done is I've brought along some x-rays, a set of x-rays, which I'm going to pass around to you, and I want you to take a look at it. Before we do that, I wanted to actually bring the titanium devices, because just to give you an idea of what they're like, I'm passing around 2 of them. They come in different sizes, and you can compare the different size. Look at that. One size is, I think, a 5, the other one is a 10. So it depends on the size of the canal, what you want to fit in there. These devices, by the way, these are like $2,000 a screw.
Wow.
So just to give you an idea of what the cost of that is. But just pass it around. You guys can feel, touch, and see what it is. I think that's pretty interesting. And let's take a look at a real patient with a real problem.
What's the yield from the surgery? How long does it take recovery?
Okay. So from a surgical point of view, I do the surgery today. In 6 weeks, you can run, jump, and do whatever you want. 6 weeks. From day 1, you're walking around the house. There's no cast on your foot. Maybe I'll put on an ankle brace with a Velcro, kind of thing to support it. But the person's walking around doing everything that they want to do except driving, running, or jumping. For the first 2 weeks, they're just walking around the house doing what they got to do. After 2 weeks, I let them, with the brace on, drive. By 6 weeks, they're done. They're finished. They can go back and do whatever they want. Okay? So let's take a look at it. Can everyone see this foot? I don't know how much you can see. So this foot is flat because the bone is touching the floor. Can you see that?
Just like sharpen.
Yeah, well, it's close to that. So this person is a 60, hang on a second, let's see what it says here. 64-year-old male. And this was in 2011. So we're now in 2016. Okay, so this is like 5 years ago. This person walked into my office and said to me, listen.
His heel's not touching the ground.
Correct. Sharp eyes. Good catch. And there's an elevation of the heel up. Notice as the foot collapses down here, this part goes up. Correct. You're seeing it correctly.
He came to our office with a bag full of orthotics and special shoes.
Right. So the guy comes to my office and says, look, I'm not an indigent person. He goes, I'm a wealthy man. He goes, I've been to the best. He said, I went to Manhattan. I went to the orthopedic surgeons. I went to the foot doctors. You know what they had told me? They told me to do a fusion of my ankle joint, that's this joint, and the subtalar joint, which is right here, and the talonavicular joint, which is here. That's called 3 joints. That's called a triple arthrodesis, which means you fuse. He goes, and then they promised me I could walk like a duck. This kind of walk. He goes, nothing's going to hurt because it's all fused. He says, but I can't walk like a normal person. He goes, I'm not doing it. So then he says to me, I went and I spent close to 10 grand on shoes, arches, braces. Didn't help squat. He goes, my name's Dr. Bakdinger. He says, Bakdinger. Doesn't call me doctor. He says, Bakdinger, what are you going to do for me different? Can you solve my problems? I said, sure. He says, no, it can't be. I said, watch. Your problem is that this talus bone is angulated downward, causing the collapse of the foot right here. See this? So we're going to do a little bit of physics. And watch. As the weight comes down the ankle joint, straight down, and it hits a curved surface, which is the top of the talus bone, where does the line of force, which is gravity, where does it go? So I'm going to make it simple for you. The answer is a bisection of the bone. So that means that I'm going to bisect the bone, which means, see my pen going right through the bone? Mm-hmm. That's where it goes. So the guy's a really sharp, smart guy. He says to me, now I understand why my foot collapsed right here. It collapsed right there because that's where the line of force is pointing to. If I can take this bone and turn it back up to the normal position, we can solve the problem. He goes, but how can you do that? I said, watch. Underneath the talus, there's this little canal hole right here. See this, everybody? Mm-hmm. If I can insert a titanium device that I just passed around, which I need back, by the way, guys.
$2,000.
Thank you. I just bought that as a demonstration.
That's all right. I have my own titanium in my knees.
Now, we're going to talk about you and knees in 2 seconds, because you brought up a great point. So anyway, so the guy says to me, fix it. I said, okay. So this is the before, and this is a month later x-ray, and you guys tell me if you think I did a decent job. Look at the height of the arch, right here, how far it is off the ground. I placed the titanium stent, and look at that. Here's the before and here's the after. Can you see a difference?
Definitely see it in there, yeah.
Now, is the heel more on the ground?
It is. It's